Rush University Medical Center is home to one of the first medical colleges in the Midwest and is now a prominent center for basic and clinical research. Not only has Rush earned recognition as a leader in academics and patient care, Rush has been a pioneer for disability inclusion.
Here at Rush, I work for the Road Home program. It's an outpatient mental health care facility for veterans and their family members. At the Road Home program, we specialize in treating the invisible wounds of war, and Rush has been great at making sure the stigma around mental health is washed away.
I have been a patient at Rush since the early 1960s, and then I became an employee later in the 60s at Rush. I have developed rheumatoid arthritis at the age of 19. I loved being a patient here because of the attitude of the people, and this was way before ADA. So I decided to work here, and part of the reason was that when I started having hand surgeries and was looking for jobs, I was refused jobs, not because I didn't have the qualification, but because of the deformity of my hands. I was told point blank that I was not suitable. And when I applied for Rush, there was no question.
They make it easy for me. Like you see, most of the desks that I work, they're all lower. All the scopes and everything, their heads are movable and everything, so I can lower them or raise them.
Rush has excelled at promoting accessibility and inclusion for patients and employees with disabilities by incorporating these core values from the top down. Rush's culture of inclusion is evident from the accessibility of its exam rooms to its medical school.
When I got here, right from day one, the correct people approached me. They're like, and they asked, what type of accommodations will you need? The big one for first-year medical school is cadaver dissections. How do you get up to the level of the table? And the solution was a standing wheelchair. It's a manually propelled standing wheelchair. You just lift yourself up, and they helped me get the funding for it and acquire it, and it really elevated me quite literally to the level of my peers to make the curriculum entirely accessible to me.
Rush has always been forward-thinking, creative, and willing to recognize the uniqueness of each person. Rush had an ADA task force before the ADA. We have leadership here and that suffuses the institution with those core values. It's not just a slogan on a sign, it's truly what people believe.
For their dedication to inclusion, Access Living is proud to present the 2016 Lead On Award to Rush University Medical Center.